Imagine for a moment your child suddenly stares blankly into space or makes repetitive movements you cannot explain. It can be a very concerning experience for any parent. Pediatric epilepsy is a brain disorder characterized by recurring, unprovoked seizures. These seizures are essentially brief, abnormal bursts of electrical activity in the brain, causing temporary changes in movement, sensation, behavior, or awareness. It is a neurological condition, meaning it affects the brain and nervous system. The why behind pediatric epilepsy lies in these unpredictable electrical signals. Our brains operate through electrical impulses, and in epilepsy, some of these impulses become overactive or out of sync. This can be due to a variety of factors, making epilepsy a complex condition. For some children, there might be a genetic predisposition, meaning it runs in the family. For others, it could stem from a brain injury, an infection like meningitis, or a structural abnormality in the brain that was present from birth. Sometimes, the exact cause remains unknown, which we call idiopathic epilepsy. It is important to know that epilepsy is not a single disease but rather a spectrum of conditions. The type of seizure a child experiences, such as an absence seizure where they might stare blankly, or a tonic-clonic seizure involving full-body jerking, depends on where in the brain these electrical disturbances occur and how widely they spread. These diverse causes and manifestations are why understanding your child's specific diagnosis is so crucial. So, what can you do if you suspect your child might be experiencing seizures? The first step is to carefully observe and document what happens during these events. Note the time of day, how long they last, what your child's body movements were, and how they acted afterward. This detailed information will be incredibly helpful for your pediatrician. Seeking early medical evaluation is key, as a proper diagnosis can lead to effective management and improved quality of life for your child. A fascinating aspect of pediatric epilepsy is its wide range of presentations. For instance, some children might have benign Rolandic epilepsy, which often resolves spontaneously by adolescence. Diagnosis typically involves an electroencephalogram, or EEG, which measures brain wave activity, and sometimes magnetic resonance imaging, or MRI, to look at the brain's structure. These diagnostic tools help medical teams understand the unique characteristics of each child's epilepsy, allowing for more personalized treatment plans. It is truly remarkable how much we can learn about the brain's electrical symphony through these advanced techniques. Understanding that pediatric epilepsy involves recurring, unprovoked brain activity helps parents recognize symptoms and take proactive steps. By observing and documenting events and seeking expert medical care, families can navigate this condition with confidence. With appropriate diagnosis and management, children with epilepsy can lead full and active lives, empowered by knowledge and support.